Hi guys, it's Danielle again. I am 38 weeks pregnant today. So there's my belly. And I figured I would do a video just kind of talking to you about midwives. What is a midwife? What do they do? Some general questions to ask when you are in the process of interviewing a midwife. So, what exactly is a midwife? By definition, a midwife is a trained professional with special expertise in helping women have a healthy pregnancy as well as birth and doing things naturally. A midwife also provides support, education, counseling to women on how to have a healthy pregnancy and how to give birth naturally. What a midwife is not is a healthcare professional as far as being a doctor or OBGYN. So typically they do not do medical intervention, nor do they do any type of technical intervention. So when they have a woman that needs care that is outside of their knowledge or expertise, they will usually refer her to an OBGYN that can assist her with that. So that's basically what a midwife is. They come to you, or you can go to a birthing center. Some hospitals even have midwives. There are several different types of midwives. The two most common is a certified nurse midwife and a certified professional midwife. A certified nurse midwife has a bachelor's degree in nursing, so they are usually a licensed nurse as well as a licensed midwife. A certified professional midwife does not have a bachelor's degree in nursing. They are strictly licensed as a midwife. However, they are governed by the North American Registry of Midwives, so they do have to keep their certification up to date. So they do have a board that governs them to make sure that they are doing things properly. So what exactly does a midwife do? A midwife pretty much does everything that a doctor does without the medical and technical intervention. A typical appointment with a midwife is going to look very similar to an appointment with your doctor. They are going to check your blood pressure, your weight, your urine sample, the baby's heart rate, measure the baby, all those basic general things. They also do blood work, your group B, strep test, and any other type of test that you may need done. The difference between a midwife appointment and doctor's appointment is they do not do vaginal exams at every appointment. Midwives feel that those are not a necessity, as usually those are done to see if you've dilated or if your cervix is ripening, and so midwives just feel like that's not something that needs to be done at every single exam. So that's the difference between a doctor's appointment and a midwife appointment. You will still have your ultrasounds done. Most midwives have a doctor that they work with or some type of imaging center that they work with where you can go and have your 5-month ultrasound done if you choose to do so. They give you the option. It's not just something that's automatically done. So you don't have to have an ultrasound done, or you can have one done. So you will still have that done as well. So that's basically what an appointment looks like with a midwife. What are some good questions to ask when you're interviewing a midwife? There's so many different types, so you'll definitely want to know what type of midwife they are, what type of educational background they have. You'll want to know how many women they see or take in a month. Most midwives only do 2, maybe 4 women a month. This is so they don't have overlaps and they can be at your birth another difference between doctors and midwives. With a doctor, he may be on vacation, he may have another patient that's in labor, maybe doing a cesarean, and then you end up with the doctor on call. Typically with a midwife, she will only take a certain amount of women a month and will schedule family vacations when she's not seeing clients, and so therefore she's able to attend all of her births. There are exceptions to that rule. For example, with us, when we had Sydney, we had her so fast that our midwife was in the process of coming to us, and I ended up giving birth right before she got there. So there are exceptions where sometimes they don't make it, but typically they are at all of their births. You will want to know how they bill. Some midwives bill insurance and some do not. With Sydney, our midwife did bill insurance. This time around, she will not bill insurance, so we'll be paying out of a pocket. Some insurance will cover midwives as well, so you'll want to check on that. You will want to ask them if they do vaccinations. Once a newborn is born in the hospital, they usually get their hepatitis B and their vitamin K shots. So you'll want to know if your midwife does these vaccinations, because if they don't, you will want to set up something with your pediatrician to have those done, or you may want to educate yourself on if that's something you really see fit to do or you don't do. It's your personal preference, but you will definitely want to ask your midwife. If they do that, you'll want to ask them if they have an EMT driver's license. I believe that's what it's called, and what that basically means is that if you go into labor, they have the capability to drive above the speed limit in an emergency to get to you when you go into labor. So that's something you may want to ask them. You want to ask them about the birthing kit, if that's something that you need to purchase, or will they provide it, which I talked about birthing kits in my last video. One more thing you will want to know, you want to ask your midwife, is does she have a referring OBGYN in case something does go wrong and you need to deliver your baby at the hospital. Some midwives have them and some do not. For us, we used my OBGYN. I went to him for consultation prior to making the decision to do a home birth, and he agreed to be my referring physician on call in case I needed to go to the emergency room and have Sydney. So that's an option as well. To me, the pros of having a midwife is that it's your birthing experience. If you do it at home, you can eat, you can sleep, you can walk around, you can get in your bathtub, you can take a shower, you can be in a birthing pool. It's your experience. You're in the comfort of your own home. You don't have to be hooked up to monitors and machines and have different people coming in and out of your room checking your blood pressure every hour and different things like that. So that's one of the advantages to having a midwife, and doing it at home, is being in the comfort of your own home. Other than that, I mean, there's really not any cons that I can see to having a midwife, other than the fact that there is no medical intervention. So there is no epidurals, there is no type of pain relief. That's probably the only downside if you're one of those people that have to have your epidural. But other than that, it's a pretty positive experience. I will post a couple of links at the bottom on more information about midwives. And if you have any questions or comments for me, feel free to leave them. And other than that, that is it. I will talk to you guys soon, and I hope you have a wonderful day.